Thank you, Mr. Speaker. Hello, colleagues. Indulge me for just a little bit as I take you down a trip down memory lane. The 2020 Georgia Legislative regular session began normally. In the second week of January, all lawmakers were back in town. Those of us drafting legislation were busily working with lawyers and legislative counsel to get the legislation completed. Our constituents were calling and visiting and the lobbyists filled the hallways. In mid-January, I heard the word COVID for the first time. I didn't think much of it, but by February, it became clear that COVID was spreading in China. It seemed a world away, and I was not overly concerned about it. But before long, we started seeing more alarming pictures of this virus. Not now called COVID-19. It was being compared to SARS, triggering many conversation amid speculation about who was likely to contract it. By March 2020, COVID-19 was spreading in Georgia, and concerns increased in the legislative body, prompting me to wear gloves to work. Still, not knowing how the virus spread. As the spread increased, legislators pressured the Speaker to suspend session. On March 16th, the General Assembly granted the governor a state of emergency under Georgia's Law 38-3-51, and the regular session was suspended. 3 days later, on my birthday, March 19th, 2020, I received a call from Georgia down here at the Capitol, stating that a Georgia senator had contracted COVID-19, and we had to quarantine for 10 days. It was extremely upsetting to learn this senator was aware that he had the virus and still came into the chamber to interact. Soon more colleagues got the virus and more deaths were being reported in Georgia, across the country and across the world. Georgia went on lockdown. The former president proceeded to downplay the severity of the virus and the number of deaths. Governor's priority was to open Georgia for business because we're the #1 place to do business, with an apparent disregard for human life. We remained on lockdown for less than the recommended time, and the lockdown was lifted before Georgia met the CDC criteria for lifting it. Atlanta and other cities across our state followed the CDC criteria before reopening. With our state on lockdown, the chairman of this House for the Democratic Caucus, James Beverly, issued a clarion call to recruit to members of our House Democratic Caucus Subcommittee on COVID-19. By May 2020, a core team had formed. It comprised of the chairman, James Beverly, and Representative Sandra G. Scott, Representative Deborah Bazemore, Representative Mary Robichaud, Representative Shelley Hutchinson, Representative Viola Davis, Representative Kim Schofield, Representative Roger Bruce, Rhonda Barno, and myself. We lucked out with 2 nurses in our mix, along with 2 educators, a business owner, a social worker, and an engineer. Using Zoom, a new platform for most of us, and Facebook Live, we produce a daily 15-minute broadcast to provide COVID-19 information on infection rates, hospitalization, combating misinformation, providing guidance on how to protect yourself, family, and your friends. Because the death rate was increasing, we also spent time highlighting that those who have passed away were just not numbers, they were loved ones. The advice to mask up, remain 6 feet distance, wash your hands for 20 seconds was repeated several times during the daily Facebook Live broadcast. As time passed, we saw a discouraging development emerge. There was a shortage of PPE, personal protective equipment, unemployment increased, leading to more uncertainty. We also saw an increase in conspiracy theories, lies, misinformation, disinformation, and the politicizing of this virus. This is a microscopic organism that have no political affiliation. Viruses don't care about your constitution, your age, your gender, your color of your skin, your economic status, or your personal freedom. On June 18, 2020, out of necessity, after a 3-month-long hiatus, the General Assembly returned to the Gold Dome to pass the 2020 budget. House members spread out into 3 rooms and cast our votes in different parts of this building. The budget was passed, and as Georgia's first hate crime legislation and a total repeal of the citizen's arrest law. With the state remaining in partial shutdown, we continued our daily COVID broadcasts. A restrictive spring and summer saw Black Lives Matter protests, unemployment protests, and political campaigns in preparation for the presidential election, all in the midst of a pandemic. Those of us seeking re-election had to find new ways of campaigning, more in social media, using social media, text messaging, no-knock literature jobs, Zoom forums, and mailers. Misinformation on COVID-19 became increasingly bizarre when the former president suggested that people take hydrochloroquine, UV light to treat COVID-19. He refused to recognize the authority of the leading medical professional, Dr. Anthony Fauci, and ignored their advice. As the former president spread his anti-science rhetoric, thousands of followers began denying the reality of COVID-19. They scorned the scientific advice to wear masks, to reduce inhaling or exhaling airborne virus, and began subscribing to and spreading wild conspiracy theories. This made it extremely difficult for data, facts, and truth to prevail. Just when I doubted that things could get worsened, public school board members were subjected to organized attack over public health guidelines for people to wear a mask, including our children. Yes, my grandson wears a mask, and he understands the reason why he's wearing the mask. The 2019, 2020, and 2021 session has been grievously disheartening for those of us who proudly see ourselves as employees of the people who we serve, protect, and foster good governance. Many of my colleagues in this body has lost a loved one to COVID-19, but showed the public an indifference when they did not speak up. As of yesterday, we have 35,302 Georgians that have died from COVID, including 48 new deaths yesterday. I am reminded that this is not about just a virus. This is about our loved ones that so many have lost and they will never return. There are also 974,000 dead people in the United States from COVID. This legislation was created for political gains to the Republican base. We have a public health crisis. Masking is one way to mitigate the harm caused by COVID-19, since it is, after all, an airborne disease. This body knows better. This means we are charged to do better. As lawmakers, we are sent here to look. We took an oath to serve and to protect. For God's sake, you owe the public the truth. Opting out during a pandemic is not an option. These are human beings. I heal the well.